Thanks for joining us at least audibly. Please give a brief 30-second introduction about yourself and some of the work that you're doing with NeuraMetrix.
Hi, so my name is Jan Samzelius, and I'm originally from Sweden, lived for 4 decades in the US. I'm a graduate of Harvard Business School and ended up running startups since about year 2000. And we've been at NeuraMetrix now for 12 years, and we're finally beginning to see some real interest in the market. All the stuff that's going on Alzheimer's is really helping.
Excellent. And can you describe a little bit about the product itself, what NeuraMetrix does, how it works, how it can contribute?
Sure. So we stumbled on that typing cadence, the rhythm by which we all type on a keyboard, is by far the strongest habit that we have. There's nothing as consistent as this that a human body ever does. And originally we had that worked up for an authentication product. But then somebody said in a meeting that I bet you that can also be used to detect Alzheimer's. And that afternoon we pivoted. And so basically the way this works very simply is somebody who's going to be, it's based on the notion of that this is the strongest habit that we have, so it's really hardwired in our brains. And so if the brain is attacked by something, then the wiring will begin to break, but it'll break very slowly and in very small increments. But our tool is incredibly sensitive. We can see changes within a person to the tune of statistically significant changes to the tune of 1/100th of a second, which of course the person and the doctor would have absolutely no idea about. And it's very simple and user-friendly. The person gets an email from us or from a researcher or somebody else, and in there's a link, click on the link, and 2 more clicks, and the measurement has already begun. And we don't use any tests. It operates completely in the background, and after 15 minutes, they will highly likely have forgotten that it's even there. And then occasionally then a file is sent to our server, and on the backside of the server, one can then see the charts, how this person is doing, and if anything has changed, etc. I think, Riley, I think that'll do.
Yeah, that's incredible. I've heard of companies analyzing your typing patterns to look at productivity, but this is a unique way to look at typing and use it for improving access to healthcare. So specifically along the lines of our discussion today with health equity and access to healthcare, what is the cost generally to the patient, and how does it enhance the ability for people to get access to healthcare and overcome some of those financial barriers?
Our product is extremely low cost since it's basically only internet and software. And we're currently really focusing on pharma, but by the time we get to actually offering the product to individuals and through doctors, et cetera, we do have a reimbursement code that would let us charge $112 per year per person. And I think we'll do just fine for that. So we'll basically, the patients will not pay anything.
That's incredible. And unfortunately, we have just a short amount of time left. So what I would ask is, can you share a little bit about how this can improve remote patient monitoring? Obviously you just need software and a keyboard, and that technology is available across the areas where maybe they have less access to specialized care. So can you talk to me about some of those kind of novel use cases that you're looking to deploy, and how that can help promote access to healthcare in areas where it might be limited?
Sure. The healthcare system, in particular when it comes to neurological or psychiatric diseases, is really all based on getting the patient to the clinic, which in particular for neurological diseases is useless in most cases. Our data shows that 2/3 of people that were called into the clinic basically were doing just fine and didn't need to be there. And not only can this be difficult for certain people in some countries, like the one I'm in, people may have to travel hundreds of kilometers to get to the doctor. And so what is happening, because the lack of our tool, is basically that the doctors are spending most of their time on people that really don't need care, and certainly not enough time on the people that really need care. And so a doctor, for example, can make a change in the treatment to a patient, and then a couple of weeks later go into our system and conclude did it work or didn't it? And if it didn't, okay, experiment in some other direction and send the patient an email about that, well, you're going to change your meds and so on, and then keep repeating until the patient is doing better.
That's incredible. My last question for you is all about privacy. So, in a world where you're operating with data remotely, and certainly it's on the top of everyone's mind, what do you do to protect privacy and data security while people are utilizing your product kind of all over?
Two things. The first, and maybe foremost, is that we never know who the person is. So, we have no way of identifying who the person is. That's all going through somewhere else. Somebody else has a list of basically our user IDs, ID numbers, and who the person is, but we never have that. And the second thing is that so our software collects data related to typing, but before our software sends any data to our server, all the original timestamps are deleted, which basically means that the sequence of what was typed is now completely gone. And thus what was typed cannot be reconstructed, because it's just looking like it's random data. Of course, it isn't. But if you remove the timestamps and you don't have any idea about what order what order the letters were coming, there's no way that you can tell what it was supposed to say, what it said in the first place.
That's incredible. Well, thank you very much for sharing a little bit about what you're doing, and we really appreciate learning about your product, and hopefully we'll hear more from you in the future.